Good evening, everyone. This is Councilwoman Brigida Field. Are you doing it? Oh, I'm sorry. This is Councilwoman Brigida Fields. This is the Health, Aging, and Disability Committee meeting, Wednesday, October the 21st, 2023 at 5 p.m. The meeting is now called to order. This is the Health, Aging, and Disability Committee. I am the chair, Council Member Brigida A. Fields for the 5th District. At this time, I will call the roll for those members of the committee first. Maria Cabrera, Vice Chair. Councilwoman Yolanda McCoy.
Present.
Councilman Albert Mills. Councilwoman Xanthia Oliver. Councilman Vincent White.
Present.
Council President Ernest Trippy Congo. As a friendly reminder, only members of the committee should be making motions and seconding. Tonight, we have a presentation from the Association of Black Cardiologists by Ms. Tanya Bain.
Thank you, Councilwoman Fields, members of the Health, Aging, and Disabilities Committee. I appreciate you having me appear before this committee. On behalf of the Association of Black Cardiologists, I am Tanya Bain, and I am a community health advocate, the coordinator for the Community Health Advocate Program for the Association of Black Cardiologists. I'm really excited to present our program, a little bit about ourselves, our program, and how it is that you can further contribute to the community in Wilmington and actually Newcastle County for aiding them in bringing to mind the spirit of the heart and how important heart health is to the community. Just a little bit about the Association of Black Cardiologists. And I'm not going to read every line of the presentation, but just to give you some background, the Association of Black Cardiologists is a nonprofit organization that is dedicated to the prevention and treatment of cardiovascular disease, including stroke, in the Black communities across the United States. With nearly 50 years of expertise, it was founded in 1974 by Dr. Richard Allen Williams from Wilmington, Delaware. He's actually a Howard High School graduate and went on to do some amazing work within our community nationally and internationally. The ABC really works to eliminate disparities related to cardiovascular disease by really advocating for research, education, and community outreach. By championing a diverse workforce, supporting research to uncover and adequately address the root causes of health disparity, and creating programs in communities is the way that we find that healthy outcomes can be reached for everyone.
Excuse me, Tanya, can you hold for one moment?
Sure.
I would like to recognize Council President Trippy Congo.
Thank you.
Thank you. So together, I really believe that we can build a future. I personally say nobody's coming to save us. And it's important for us to do the work, to train the community in the work so that they can sustain not only the existing people in the community, but our future. All right. There's scarcity among us, and we are the answer to the problem. People are the answer to the problem. So just a little bit about the strategic pillars for the ABC. We seek to advance health, cardiovascular health disparity by focusing on 4 strategic pillars. All right, the diversity of the workforce, all right, clinical trials and research, community health programs, which I'm going to be primarily speaking about, and advocacy and capacity building. So this is our why. Cardiovascular disease and stroke is the #1 killer of Americans. 1 American dies every 34 seconds from cardiovascular disease. There are 650,000 plus deaths every year. And 38% of the deaths are attributable to cardiovascular disease and stroke. There is a disproportionate impact on the Black community. 30% of Blacks experience a higher mortality rate than whites for causes of heart failure, cases of heart failure. 20% of Blacks are more likely to develop heart disease at a younger age than whites. And Blacks are twice as likely to die from a stroke. Let's look at some numbers here in Delaware. The disparity, the hypertension prevalence in Delaware by race. There is a 40% prevalence, okay, in heart disease among non-Hispanic whites, non-Hispanic Blacks and non-Hispanic whites. Specifically in Wilmington, by zip code, the hypertension and antihypertensive medication used by zip code in 2021. So I just want to dig in a little bit further here. In zip code 19801 and 19802, there is a prevalence of hypertension of 37 to 43%. In other zip codes in Wilmington and Newcastle County, there is like 31%, okay? So this is the prevalence. This is alarming. The antihypertensive medication use among adults with hypertension in Delaware in the 19801 and 19802 arena is 82 to 88%. Disproportionate. And again, in Newcastle County, those numbers are staggering. More numbers. The essential hypertension and hypertensive renal disease mortality among non-Hispanic white males, you'll see that it is around 8%. In non-Hispanic white females, it's about 8%. And for non-Hispanic Black males, it's close to 13%. The same thing with non-Hispanic Black females, again, at a disproportionate rate that they are affected. More statistics. Black males are more likely, 60% more likely to die than white males, okay? And the death numbers are close to 75% of Black males don't survive. So along with the other diseases, diabetes, just any type of medical condition, heart attacks, strokes are killing our black males at a disproportionate rate. Now, there are reasons for that, stress, economic conditions, all of the reasons that, other people talk about, but we're always disproportionately served and found that in our black communities, our brown communities are not being served. So what's our solution? Engaging in the community as a true partner for change is important. We believe that the fight against heart disease is a collective effort and requires community-wide participation because the medical community can't do it itself. Our vision is that through health promotion programs, strategic partnerships, and a network of passionate community health advocates, we strive to develop some innovative approaches to saving lives. The solution we have is that we recognize the need to expand our reach and resources to touch the lives of even more communities across the nation, and particularly in Delaware. We've had several initiatives, and Councilwoman Fields attended our summit, and we had great experts. We had even more statistics about the heart disease in general, but the prevalence of deaths among the people in our communities. We are proposing, I did want to mention that we have advocates in the qualified community health centers, La Red Health Center, West Side Family Health Center, and of course Henrietta Johnson Medical Center. They provide great services for our community, but it doesn't always reach everyone. We are proposing a community health advocate training. We will build capacity through training and leadership development. We can mobilize our community toward an integrated approach to reducing the burden of cardiovascular disease, engaging the community through partnership, development, and community participation. I can't say that enough. Community participation in planning, and a systems approach to linking community education with clinical management. So what is the Community Health Advocate Training Program? Our goal is to train and empower individuals to serve their communities as community health advocates, to engage the healthcare and political systems to reduce the disparities in cardiovascular health experienced disproportionately by African Americans. Community health advocates can be anyone in the community that would like to drive change in health for their families and neighbors. While the program is designed to provide education and strategy to individuals with little or no past experience, we also want to engage seasoned nurses, medical professionals, and practitioners to learn more effective ways of communicating the risk factors for heart disease. The CHAT program is designed to educate community health advocates on policy issues and to teach more proactive approaches toward influencing change that affects the well-being of all. Our health advocate training program takes about a weekend. So it's a Friday evening, a Saturday, and a Sunday afternoon. We use the With Every Heartbeat is Life Community Health Worker Manual, and it is a resource developed by the National Heart, Lung, and Blood Institute specifically for African American communities. There's a manual provided, and the manual is culturally sensitive and language appropriate to help community health advocates deliver effective education to the communities that they serve. In addition, the With Every Heartbeat is Life Community Health Worker Manual, the National Heart, Lung, and Blood Institute also provides a set of picture cards to use while teaching the manual, and an African American healthy cookbook, as well as other promotional resources to help the community health advocates with the program. It's important that we understand that the key to making the community more viable, to understanding the health equity, to understanding the language that needs to be spoken to our communities, our community folks can get to the people. We are not proactive. I'm not proactive, with my health care. If people don't know, they can't be served. The community health advocate is going to learn what the community needs, learn different approaches to communicating that, and referring them. We don't expect them to be medical professionals, and referring them to our cardiovascular specialist, to our community resources, so that they can get help. The emergency room is not the place for people to get help. That is acute. So we need to really implement some preventative measures. In our communities, I'm just thinking about the nurses that are in the churches, okay? They're the ones that discover what the issues are with the people, all right? They're the ones that discover what the inequities are. So we really want to train a group of folks that will be able to teach, to learn, and to teach the community what they need to know and basically save lives. So how do I become a community health advocate? You just need to call me. The ABC is always looking for ways to partner with communities to improve health outcomes in heart disease. If you're interested in learning more about the program, my number is 302-321-5242, and I am the ABC Chat Coordinator. What is it that we're looking for? What is the ask? Partnership building, recruitment, and advocacy. We need you to recruit chat workers. They're constituents in your community. They know better than us what the needs are. I would love for every Wilmington district to identify 5 constituents, just 5, to participate as chat workers. Of course, we need financial support. We'd like to obtain $15,000 in financial support aimed at improving the ability of chat graduates to implement the programs in the community. So often, we look for volunteers, and it's a great thing. But we would love to provide a stipend for those volunteers, for different ideas that they may have, resources for different ideas that they may have, just very simple things. So we're looking for about 30 to 50 chat community advocates, 30 to 50, okay? We're looking at less than $500, all right, per person, to really make a difference in the community. And we want to collaborate with the committee to develop different partnerships to build a healthier community. I wanted to go back to, go ahead and advance to the 7 steps, because I really want to, 7 steps to a healthy heart, the markers. We need to understand this. We need access to better health care. Take charge of your blood pressure. Control your cholesterol. Track your blood sugar. Eat smart and enjoy regular exercise. Don't use tobacco, and be spiritually active and reduce stress. You should visit a healthcare provider at least once a year. You know, we talk about optimal blood pressure is 120/80. Total cholesterol should be less than 200. Normal blood fasting blood sugar should be less than 100. 150 or more minutes per week of moderate physical activity. Enjoy a balanced meal. And attend worship services on a regular basis, and actively engage in ways to reduce stress. Do you have any questions for me?
Councilman White.
Well, I almost left the chamber, given those first, I guess you would call, descriptions of how I might pass away. But the information, as always, is very, very difficult to hear.
Yes.
One of the things I did not hear you say, and is that many of our people deal with this implicit biases. They are in the healthcare, and their good intentions, as they may, sometimes meet these biases, and that's obviously discouraging. So maybe you want to talk about how, well, maybe we know. Why don't you talk about how to overcome some of those biases or recognize them, if you don't mind?
All right. In fact, I had an experience this week with a healthcare provider who I'm going to change, who was not sensitive to the language that I used. I'm pretty savvy, but they were using language that I didn't understand, so a whole lot of medical talk, and it made me nervous. So we really need to train our people, the community health workers, on how our people can ask questions to their healthcare provider.
Yeah, but and again, just conversation.
Yes.
We want the same thing everybody else wants.
Absolutely.
We don't want anything different, at least in my opinion, dealing with the healthcare. So why is it consistent? And I might be asking the question, but you're dealing with a health crisis or potential health crisis, or trying to mitigate one. And for us, black people, brown people, then we have to deal with all these other attitudes that delays our remediation of these needs. And I just feel as though the healthcare community, they know where's the accountability on that side, because at the end of the day, you've got to change your healthcare provider because of something. It doesn't diminish what you've got to do health-wise. It seems like we're always dealing with that issue and this, and I just think it's problematic. And I'm just saying that I would hope a part of this accountability that you're putting on the community is also being applied to the healthcare industry.
Absolutely.
Thank you.
So the Association of Black Cardiologists is specifically centered on cultural competency, okay? In teaching or educating all communities, okay, all healthcare providers on how to speak to our people, all right? So we have the initiative. We know, is one of our founding principles. We know that it isn't we know that it isn't fair to our communities. We're highlighting those aspects of care. But in the meantime, okay, in the meantime, we still need to serve our community. And it is it's an unfortunate disparity. So while we're looking to educate other practitioners and providers, okay, about competency, we're doing the work. We're working the solution to make it happen. Policy and politics takes time. And we're about making it happen and having some action.
Thank you for answering that. Anyone else? Council President?
Thank you, Madam Chair. Thank you for your presentation. Where do you think, if you do believe it at all, that the public school system has any role in education or making sure the kids are getting enough exercise? I guess, and I say that because it seems like children don't have gym.
No, Jim.
Yeah, as
No
like every day.
sports.
Right.
All right, one of the initiatives that we are undertaking as community health workers, advocates, is to really reach out to the schools, organizations that serve youth, all right? Implement, healthy eating programs, okay? Implement exercise programs. So it really is on the community to serve. Again, of course, we need the advocacy, okay, in the school system, but we want to do something about it as well.
Okay, thank you.
Is there anyone online that would like to ask a question? No. I do have. Oh, yes, I'd also like to recognize Councilwoman Maria Cabrera. My question is, you said the classes are on the weekend. Do you have a schedule for these classes?
I do not have a schedule for the classes. They're more than likely going to be towards February because the holidays are coming up. And we don't want to, there are a lot of activities around the holidays. So it will likely be around February, okay? But we are taking, I'm taking names and information immediately so that we can bring people on board.
All right. Councilman White?
Thank you for your generosity, Madam Chair. I just have one more question.
Yes.
I'm a former Wilmington Housing Authority Commissioner. In that, and I'm not speaking on for them, but as my 16 years as a commissioner, we have 5 high-rises. I've not yet seen a consistent effort to identify or work with that population on all those micro issues. So I guess that's low-hanging fruit to
Yes.
me. I don't know what your thoughts are. Is there any thoughts of targeting that population that is captured in those high-rises?
Absolutely, absolutely. I have some experience working in another community organization, and we actually target the aging centers. Okay, we actually target WHA. We participate in presentations. I am planning to duplicate that effort with the community health workers because you're right, low-hanging fruit. There is a wealth of people that are there, and we can simply just go there. I know that the Housing Authority has presentations that they give for their residents. So I love the idea, okay, and we'll continue using that strategy to bring about, getting the information to the right folks. And we could use some community health advocates in those high-rise buildings too.
Oh, you're welcome. I have one more question for you. Now, is this a nonprofit organization or is it for
The,
profit?
Association of Black Cardiologists is a nonprofit organization.
Okay. All right. So, Ms. Bain, we would like to say thank you so
Thank
much
you.
for coming and presenting us with this information. It's a lot to take in. My mother did pass away from a stroke.
Yes, my
So, you know, everything that you're saying, it kind of just plays, plays back in my mind about when you go to the cardiologist, they do talk to you as if, you understand their jargon. So I didn't, so I would have to make them explain it to me. And my mom was from the South, so she didn't like going to the doctor, so she had to have me there so that, I'm like, okay, you have to break it down for us, as if I'm in the third grade, break it down and show me some pictures and different things like that. So we did go through that, and it is a bias, unfortunately, and until all of us become doctors or we get enough for our population in there becoming doctors, this is something that we can continue, we might continue to face. Hopefully our little boys and girls grow up to go to college and become doctors and change the scenario, right? But again, I would like to thank you so much for coming and doing your presentation. If you have any more data or information that you would
Yes.
like to share, please don't hesitate with sending it over, and I will share it with my colleagues. Hopefully, they'll get a chance to look at the presentation. I think we
Yes.
put them on everybody's desk, so they'll have a chance to look it over, even though they're not here. So, with that being said, is there a motion to adjourn?
Motion, Madam Chair.
Second.
Okay, it has been properly moved and second to adjourn. All those in favor signify by saying aye. Aye. Those opposed? Motion carried. Thank you, everyone, for coming.
Thank
Thank you, Ms.
you.
Payne. I appreciate you.